case study presentation. The case study is most important for patient assess the cases. Okay, first we'll see about assessment. Assessment is important for the patient information collection. Okay, the first one is the subjective. Subjective, objective. What is subjective? Subjective means data for patient own words. Okay, that is a subjective. Objective means data for therapist any tool. Okay, that is a objective examination. Okay, subjective examination. First we will see about demographic data. Demographic data. Okay, for demographic data, you will see about under the demographic data, patient name. This is for identification. Okay, then you will go for patient age, name. Second, patient age depends upon the age. Age criteria is disease progression. Okay, for children are most common trauma, sports injuries, any congenital disease. Okay, any 20 to 30 years, these population common for neck pain and back pain. So college and school going students are most commonly back pain. These are conditions common. More than 40 years, more common for degeneration. Degeneration disease. Degeneration means old age people. Most occurs in the bones are weakened structure. Okay, this is the age criteria. Then you go for gender. Gender male and female. Some diseases are common for male, some diseases are common for female. Okay. Example, rheumatoid arthritis is more common for female. Then osteoarthritis is most common for male. Okay. Example. Then you go for occupation. So occupation related diseases are common. Example, tailors are most commonly in the neck pain and back pain. Okay. Then either any security workers, you will most commonly for prolonged cough pain. Prolonged standing workers, cough pain, knee pain common. Okay. Then you will go for name, age, gender, occupation, then date of assessment. Date of assessment important. Date of admission. Okay. In case inpatient இருந்தாங்கன்னா அவங்களோட டேட் ஆஃப் அசஸ்மெண்ட், டேட் ஆஃப் அட்மிஷன் வேணும். டேட் ஆஃப் அட்மிஷன் இது அவங்க வந்து ஓபியா அவுட் பேஷண்டாக வராங்கன்னா அவங்களுக்கு டேட் ஆஃப் அசஸ்மெண்ட் மட்டும் இருந்தால் போதும். இன்பேஷண்டாக இருந்தால் டேட் ஆஃப் அட்மிஷன் அண்ட் டேட் ஆஃப் அசஸ்மெண்ட். அவுட் பேஷண்ட்னா டேட் ஆஃப் இது மட்டும் அசஸ்மெண்ட் மட்டும். ஓகே. தென் வில் go for these are the criteria for demographic data. Then we will go for cheap complaints. Cheap complaints. In cheap complaints, to say the patient own language, that is a cheap complaints. Okay. Example, patient's complaints of knee pain. Complaints of knee pain. Difficulty to move their knee movements. Okay. Difficulty to functional activities. Difficulty to stair climbing. Okay. These are the patient own language. That is a cheap complaints. Yeah. To write about the patient own language, that is a cheap complaints. Then you go for history collection. Okay, history collection. Okay, history la first we'll see about past medical history. Okay, past history. So this some condition relevant to past, any trauma, then in previous surgery. Okay. Then these are the collection of data from past history. Then associated problems. Example, diabetic, hypertension, heart problem, asthma. The problem are clear. This is the associated problems. Okay. Then this guy, anyone is patients will present diabetic for 5 years on medication. So mention the medication. Okay. Then we will go for past, then family history. Some diseases are common for family history, genetic. Example, rheumatoid arthritis. Okay, these are common. So family history is important. Then you will go for surgical history. இப்போ சர்ஜிக்கல் ஹிஸ்ட்ரினா வாட் இஸ் த சர்ஜரி, டைப் ஆஃப் சைட், என்ன சைட் பண்ணால், டைப் ஆஃப் இன்சிஷன், விச் சைட். Okay, this is important for surgical history. Then we'll go for personal history. Yeah, personal history. Personal history na any patient have smoking, alcoholism, then our diet pattern, stress, then bladder and bowel habit. This is under the personal history. Okay. Then we'll go. These are all about subjective category. Okay. Only to tell about history collection. That is a subjective. Then we'll go for objective. Objective means to assess the therapist. Okay. So example, our case is a knee pain, but knee pain related assessment. Okay. Objective means three category. One is observation, palpation, examination. Observation, palpation, examination. Okay, observation means to observe the patients. Okay, then palpation na therapist to palpate the some structures. Then examination na this is examination procedures. Okay, then example observation, what are the findings observed the patient. Okay, redness, skin changes. Any skin changes will show the patient. Okay, then body build, patient appearance, ectomorphic, endomorphic and mesomorphic. Okay, ectona maligna irupanga and mesona neutral irupanga, endona obese irupanga. Then next வந்து attitude of limb ஓட பொசிஷன். limb நீங்க அசஸ் பண்ணும்போது என்ன பொசிஷன்ல இருக்காங்க, டோ ஃப்ளெக்ஷன், எல்போ ஃப்ளெக்ஷன் வச்சிருக்காங்களா, ஷோல்டர் எக்ஸ்டென்ஷன் வச்சிருக்காங்க, இப்படி அந்த பர்டிகுலர் லிம்போட பொசிஷன்ஸ் இருக்கும். தென் swelling, to observe the swelling. Okay, then swelling is present which side, knee or ankle joint. Then you go for muscle wasting, to observe the muscle wasting. To observe the muscle wasting means bulk, muscle bulk is the different changes in the both limbs. Okay, then you go assess the gait also observe the observation finding. Okay, then you will go for any external appliances. Any external appliances means splint, rib bandages, IV line, catheter. These are external appliances. Then you will go for palpation. Palpation will palpate the tone, process tone. How to assess the muscle tone? To feel the passive movement. To do the passive movement, to feel the tone. Okay, one has muscle tone 0, that is a flaccid. Okay, muscle tone 2 is a normal, more than 2 is the spastic. Okay, tightness of the muscle. Okay, then we will go for muscle tenderness. Okay, tenderness means pain, foregetting is present. First one is the mild pain, second is the pain and winces. Pain or facial expression is a winces. Third is the winces and withdrawal. The facial expression வந்துட்டு அவங்க கையை தட்டி விடுவாங்க, that is a withdrawal. Then unable to touch, foregetting. So pain is site of pain na example knee joint pain, grade 1 or 2 3 4, mention the tenderness grading. Then you go for observation finding swelling. Okay, to differentiate the swelling edema, so palpate the edema. To palpate the skin structure, in case dimple, you form the dimple, that is the edema. No dimple is for the swelling. Okay, pitting, non-pitting. Pitting na is the seconds, 4 gets இருக்கும். Grade 1 is the less than 25 seconds. Dimples 25 seconds இருக்கும், அதுக்கப்புறம் disappear ஆயிடும். 2ல வந்துட்டு 50 seconds இருக்கும், disappear ஆயிடும். 3ல 75 seconds இருக்கும், disappear ஆயிடும். 4ல 100 seconds இருக்கும், disappear ஆயிடும். ஓகேங்களா, இது 4 graph dimple. Then pitting edema is most common for sports injuries. Okay, sports injury and any fractures. Non-pitting is common for any systemic organ dysfunction. Kidney failure, liver failure. Okay, then you will go for distal pulse. Okay, any radial pulse, dorsal HPDS pulse, that is a distal pulse. Okay, then we will go for examination finding. First assess the range of motion. Okay, any joint, particular joint range of motion. Then sensory assessment to assess the sensory part, superficial and deep, touch, pain, temperature. Then pressure, by deep is pressure. Then range of motion, then we will go for muscle tone is the mentioned the grading. Okay, then muscle power, is based on MRC grading. Okay, medical research council grading. Okay, 0 is for no contraction, 1 is for flicker of contraction, 2 is for movement with elevated gravity, 3 is for movement with against gravity, 4 na against gravity with minimal resistance, 5 na against gravity with maximal resistance. Okay, these are muscle power grading. Then we will go for reflexes, tuning for reflexes. Okay, reflex. Then we will assess the balance and coordination. Muscle girth, is mainly for arm muscle, forearm muscle, thigh muscles and leg muscles. It's a symmetrical normal. Is asymmetrical is a muscle waste is present. Okay, then we will go for balance and coordination. To assess the balance, first we will go for straight, both feet straight together, then eyes closed and eyes open. 20 seconds common, maintain the standing. Any sway present, balance disturbance, static balance. Either single leg standing, maintain the patient, that is a dynamic balance. Okay, then coordination is mainly for any movements, repeated movements to the coordinations. Okay, these are about the examination. Okay, the objective examination. Last of all, we go for find out the investigations. Investigation for any fracture, we will go for X-ray. Okay, any soft tissue injury, you will go for MRI. Okay, a soft tissue injury, MRI, before that ultrasonography. Okay, to assess ultrasonography. Then any infection to show the blood test and urine test. Blood test common in the CBC. Complete blood count. இதில் வந்துட்டு ESR இருக்கு இல்லையா, ESR level is elevated, infection rate higher. Okay, first one. Then RBC content is elevated, is also content of infection. Then WBC is higher, more than infection of the body. Okay, in platelets is reduced, we will go for bleeding disorders, chances for bleeding disorder. Okay, then these are about CBC finding. Okay, then urine test, you will go for urine sugar level, then uric acid, then any infections, crystal formation. These are about the urine test. Okay, these are investigation finding. Then last of all, any disc lesion, no ulceration, followed the MRI. Okay, then finally you reaches the diagnosis. Okay, this is the total of the assessment of the patient need. Okay.